It's a great pleasure and honor to have you here this morning. And I will start just with the program of this morning with very brief information. So we will start with the presentation of Professor Jair Mari that will take 40 minutes. Then we'll have the presentation of Professor Jean Van Os from the Netherlands. After that, we will make a 10 minutes break, really 10 minutes. And then we'll have our opening ceremony, followed by FAPESP presentation. Okay? Thank you very much and have a good event.
Okay, thank you. Welcome to São Paulo. I'm really very excited to have all these people around. So it's really, thank you for coming. And I wish you will have a very good time in São Paulo and having the opportunity to meet so many interesting people, all put together in name of prevention of mental disorders. So it's a real pleasure to have you all here. So we start talking a little bit about some problems in Brazil. For instance, there has been many interesting papers lately published at Lancet. I hope all the students of the Y-Mind School, they should be reading these papers if they have not done it yet. So some problems in Brazil. For instance, our mortality rate for traffic-related mortality in 2007, 38,000 deaths. If we go, it's not working, Jean. Yeah? Yeah, okay. If we go to homicides, for instance, also we don't have very nice numbers to show. So the rate of homicide is 26 per 100,000 in Brazil. And what is really important to us, if we take the age group between lower than 19 years, so we can see this blue, this blue part of the graphics showing the increase in mortality by homicides for children and adolescents in the country. What's happening? We are improving the health of adolescents from natural cause. We are decreasing mortality, but mortality by external, unintentional, and intentional injuries, they keep still very high in the country. And what is interesting also is that we have been doing a little bit of advance in Rio de Janeiro and São Paulo in terms of mortality rates, but violence is moving. So it is very common now to have violent plays really increasing in the Northeast. For instance, in Maceió, this place from Alagoas, places like João Pessoa, São Luís, Recife, Vitória, they are really increasing a lot the rates of homicides, particularly among adolescents and children. And for instance, in João Pessoa, where we have an interplay of gang fights, drug traffickers, and poverty. So this mixture has been really making lots of impact on homicide rates among adolescents and teenagers. So the one study we did in Brazil was to have an idea of violence in two cities, São Paulo and Rio de Janeiro, just to give a little bit of fright of people visiting Brazil, right? It's not a very good subject in the morning warning everybody about what happens, but we hope everything is going to be fine during your stay here. So we had this Institute of Mental Health and Violence, and we did stratify the city of São Paulo by mortality rates, so to have an idea of the geographical difference and impact on mental health in these different places. So I'm happy to tell you, you guys are here in the place where is the homicide rates in this area is 4 per 100,000. Is about the same as in New York and London. So don't worry too much. So we got near 4,000 people. It was very difficult to go in the slums to have this research, so we had to be really careful in planning it, and response rate wasn't too bad. We used the CD, training lay interviewers to have the mental health assessments of these people, and so we can call attention. Firstly, near 90% of people have been exposed to at least one important trauma in these large urban centers in Brazil, São Paulo and Rio. So, and for instance, you know, physical assault with weapon, lifetime in Rio de Janeiro and São Paulo, near 1/3 of the population. Rape, 2.3% in Rio, 1.3% in São Paulo. Shootout, stray bullet, near 30% in Rio de Janeiro and São Paulo, 16%. Also, domestic violence, lifetime prevalence in around 16%. So we were very worried about these statistics. And this is the prevalence of, lifetime prevalence of mental disorders. It's not so different what we can see in the most of the epidemiological studies done in the United States and in some other place around the globe. So we have about the same problems that you would find in westernized countries. This is valid to São Paulo and Rio. But anyway, just to have an idea of 1 year prevalence of PTSD is going to be 5% in São Paulo and 3% in Rio. This was very interesting because in Rio they are more exposed to traumatic events, but they have a better place to go in the afternoon, the beaches, you know, very nice atmosphere. And in São Paulo, you have nowhere to go, just restaurants. But anyway, this is probably one of the reasons we found a lower prevalence of PTSD in Rio de Janeiro. So you can have a very nice time in Rio. So trauma was related to virtually most of the psychiatric disorders. The only exception was to mild depression. So trauma is not only related to PTSD, but trauma is associated with an array of psychiatric disorders. Of course, this is a cross-sectional study. We have to not to disregard causal reversality, and so we have to be aware of this. Also, what we found, if we compare people, they are under treatment, we will see that most of the people, they have no treatment. They have not been under, for instance, psychiatric medication. So this is also, we know it happens everywhere in the globe, but the gap here is really high. I mean, only 20% of people with severe depression have been making use of antidepressants. So we have a huge problem in the mental health service Still, we have a lot to do in terms of organizing better, particularly in these two major urban sites. So a huge gap in PTSD, OCD, and most of many psychiatric disorders. Another research we did was about parental bonding. So we can see the importance of the relationship between the mother and the infant. So we have done a review about the role of early parental bonds. This is a PhD student from our department and our colleagues. What we did from this epidemiological study, we took patients with PTSD, cases with positive diagnosis of PTSD, and cases they were exposed to the same trauma and they didn't develop PTSD. So this was an interesting equation for having a case control study. And so we went, at this case, we went to see parental bonding, and also we have a neuroimage and the investigation of the HPA axis. What was interesting is that there was an association between a controlled mother, they are very controlling, they could be, let's say, risk factor for PTSD development, and affective parents, the male, the father, an affective father would act as a protective factor for developing PTSD. Again, here it's a case control study, you know, this is a retrospective memory, so we can have, we can't be completely assured. This could be done only by longitudinal studies. But anyway, there is a hypothesis that health experience of parental bonding characterized by perception of nurturing, parental control, and affection were positively associated with lower risk for PTSD development in adulthood, suggesting that affective enrichment and incentive to autonomy are factors of protection against the PTSD development in adulthood. We sent it last week to biological psychiatry. Probably it comes back very soon. We never know. But it's at least has been submitted to biological psychiatry, is under review. And this is to show some of the studies we have been doing in our department. This is the group of Isabel Bordin, Cristiane Duarte, Bartira, Cristiane de Paula, working in these harsh conditions. So this is in the outskirts of São Paulo, as you can see. Still, we have a lot to do in terms of housing and better social conditions in the country. The situation is getting better, but still we have a very, very difficult place to live. So we, Isabel and her team, they took 1987 mothers and these children between 6 and 17 years, using WordSafe core questionnaire, self-report questionnaire to have an idea of the mental health of the mothers, and the child behavior checklist, which has been translated and validated to Portuguese for many years. So here is, of course, it's a summary of the findings, but showing, again, this severe punishment related to externalizing disorders and to the comorbidity with internalizing disorders. And so if we have only externalizing disorders, the odds ratio is 7.9, comorbidity 2.7. So severe physical punishment may be cause or consequence of child mental health problems to be confirmed in longitudinal studies. So we have to improve the design of our studies. So we have lots of data, but anyway, very important to show the importance of factors that are meant to be protective. Abortion is a very, very sensitive topic in Brazil. And this is a very interesting paper because it says a new look at teenage pregnancy in Brazil. But just for you to have an idea of the situation. Abortion is illegal, is a criminal act in Brazil. But if we see the data, for instance, of this research, you will see that people, when they get pregnancy, they not all will become childbirth. The number of abortions in Brazil is around 1 million per year. It's not a joke. So it's a huge problem, and it happens very frequently among the poor, the low educated, where you have a very high probability of mortality being higher. So we live in a secular state. Surely legislation should change in Brazil, and not making abortion illegal. Well, if it were illegal, there would be no places in jail for everybody. I mean, there is no point. You have to accept that this is a terrible situation where it puts the mothers and teenagers in particular in a great risk of mortality because of the conditions, unsafe conditions abortions can be made in this population. So if you didn't see this paper, you should, particularly message it to the students. We have to see that the most of the problems in the age group 10 to 24 years will be of neuropsychiatric disorders. So depression, very important, road traffic accidents, schizophrenia, bipolar disorder, violence, alcohol, self-inflicted injuries. So most of what is happening in the health of teenagers are related to psychiatry. So we had Christian Killing, one of the papers published recently in the Lancet. He is here in the school. That's why we are giving as an example what we expected from each student of this Y-Mind school to publish the reports then in the Lancet, okay? So this is a very well done paper showing the importance, prevalence of mental health problems in children. And again, you know, the message that psychiatric disorders are chronic conditions of disease that happen in adolescence. And then this is a very important message. So that's why we have to focus on adolescence. So these papers from Susan Sauer, she published this recently also at Lancet. Why adolescence? Because 44% of married girls live in developing countries want to avoid pregnancy, unsafe abortions, high mortality. More than 1 million becomes infected with HIV. Mental disorders present before age 24 and 50% before 14 years. Road traffic accidents are killing lots of teenagers. 17% of children use tobacco. Well, you know, the other very sensitive issue is drug traffic and the problem of drugs. Nobody's gonna end the use of drugs in the world. But what we are seeing now, for instance, with tobacco in developed countries where people and teenagers are beginning to refuse it, or at least to the consumption has been decreasing. So one question is, how can we convince teenagers not to consume drugs? How to show them that would be better to live without drugs. This is a great issue for prevention, instead of treating people when they have already a very heavy addiction. So this, again, this paper, so everybody should read it, particularly the students, these 3 papers. And there are very good news. There are lots of things that we can do to prevent in prevention science. And this is the main reason we are all here. So we can interchange in a global perspective. You know, what sort of actions can we do where we know that really can reduce harm and the burden of neuropsychiatric disorders. So very interesting, the axiom of Jeffrey Rose. Jeffrey was a very important epidemiologist from the London School of Hygiene and Tropical Medicine, and he did influence heavily the actions on cardiology, and we saw how cardiology has changed a lot in terms of improving people's involvement in physical activity, in dieting, in less use of tobacco and less use of alcohol, having a more active life, how the impact of these actions in cardiovascular diseases. What is important in this axiom is to have an idea, and Jean is going to talk about this, how is the distribution of symptoms and problems and psychiatric problems in the population. It's far more important to ask, not to ask, what do you have of it, but how much of it you have. So, you know, it's the dimensional approach and the link between the sick and the healthy, and how to tackle this from the prevention perspective. In this sense, reducing a small amount of risk in the general population can be more beneficial than reducing larger amounts of risk in the smaller, high-risk segments of society. This axiom is very important. So the efficacy of many preventive interventions has been established and provides a strong foundation for action. And this is one of the main reasons we are here. How can we exchange the experience, what sort of interventions they can be implemented in different countries, how can we integrate from a global perspective preventive actions in mental health. Improved translation of efficacious prevention programs to standard practice is needed across all nations from low to high income countries. So, good. Look, you are here. Is everybody here? You know, it's welcome to the Y-Mind School. It's a great pleasure to have you all guys here. And we are really grateful to FAPESP, who was the main collaborator, the laboratories, our foundation from the university, and you, of course, you know, and particularly really thank you for the academics. They came. We know of the busy agenda, so these people are top people in psychiatry, so it's a real pleasure to have this meeting in São Paulo. So there is a long list of people to say thank you. I will say more of that in the opening ceremony. And anyway, this is the professor, is the sign. I have an announcement, you know, photos will be available. I will leave it for you to copy already. So the pictures of the Y-Mind School will be, you can download at this place. At closer look, nobody is normal. There is no health without mental health. Thank you.